Good morning. My name is Marcos Espino. I'm the Director of Communicable Diseases and Environmental Determinants of Health of the Pan American Health Organization, which is the regional office of WHO in the Americas. We have an exciting new session, not to say the last session was very exciting. And let me start by building a little bit on that. I think one of the greatest, and going back to the discussion between Dennis and Rachel, one of the greatest mistakes of the international community was to leave out the NCDs of the MDGs. You all remember the MDGs in 1990s and 2000, nothing on NCDs. And this is why sometimes we're missing the point that NCD has been always there, and there is some evidence, as Rachel said. But the advocacy, communication, and education, which I think people refer to, has been missing for NCDs. And it's at fault, thanks to the Caribbean countries that had a huge burden of NCDs that they pushed Secretary General of the UN to bring the NCD a special summit, and then started to bring and pay attention. The other thing I wanted to put in context is those of us who has a little bit of gray hair cannot forget the mistakes of the 70s and 80s with health sector reform in Africa, when the World Bank and the IMF were coming with these imposing policies of not hiring people, of setting salaries. That kills several disease control programs. Malaria, HIV, TB, principal malaria and TB went all up and up after successful programs were running well. So countries were in the middle of not hiring people. The point is that convergence or synergies, it's about identifying best practice. Let's not kill what works by doing some nasty convergence. To me, the best way to synergize is how can we put together best practices that can be used by the communities and by the first level of care, and also by the second level of care, because we recognize there are interventions that cannot be done at the first level of care, and more sophisticated interventions. So I think it's important also to remind ourselves, and we've been talking about health systems, and make a complex issue simple to ministers. When we explain to ministers, we need to make sure they buy out this. They don't come and say, well, how are you going to do this? Because otherwise, we'd be voices in the desert. It's only one health system. It's only one procurement system. It's only one health worker. It's the same health worker that is in the health clinic in the middle of nowhere, isolated, dealing with TB, dealing with HIV, and dealing with NCDs. And also it's the same person. And that parallels of the old principle of TB and HIV. It was two diseases in the same person. And remind me about that. Now we're talking about convergence and synergies for NCDs. Having said all this, keep in mind that if this workshop can make some good recommendations, or at least some recommendations that not only this country for the well-being can take, but also other countries, middle-income, low-income countries, then I think we're doing our job. At the end of the day, it's important that governments take some of our recommendations and put it in place, that we don't go out without some important lessons learned. And this is what is about this session. And for that, I'm pleased to introduce the panel. Here is sorry. I'm not going to read bios, because I think it's very clear that we know all of them. But the first speaker is Miriam. Miriam Rapkin, Associate Professor of Epidemiology at Columbia University, Mellman School of Public Health. I was just asking Miriam if WAFA is still there, because I bumped it in preparing for this workshop in some of the paper, early paper of WAFA in NCDs. So Miriam has been working in the area for 20 years, and she has also worked in focusing Sub-Saharan Africa, and a consultant of the Rockefeller Foundation, and has a broad experience on HIV scale-up and integration and synergies. So since we're going to see today different models and best practices, let's take it from there. Miriam, you have 12 minutes to enlighten us. Thank you.